Welcome to the September Resident Council meeting. I'm Fran Baker, your president, and you're going to have to listen carefully because we will be wearing our masks even when we're speaking. So sorry for the lip readers, but that's the way it is. So we'll begin our meeting with some words from Maria Timberlake.
Hello everyone, I am here in Dan's place. He apologizes that he wasn't able to make it today. I thought it would be best to use our time together to touch base on a couple of COVID-related issues that people have been asking about. The first is about booster shots. And if you've been paying attention in the news, there's still some questions out there related to boosters. Who is going to get them? What boosters might be available and when? So we are monitoring all that information, and we are in active discussion with Cimbria, who is our pharmacy partner, and we are gearing up to be ready when we do get those details so that we could bring an appropriate clinic onto our campus. And we would anticipate it would be something along the lines of what we did when you got your first vaccine. So I know a lot of you are very anxious and asking a lot of questions, and please know we will reach out to you and communicate very thoroughly and timely once we have the details. We don't want to get too far ahead of ourselves and then have to change those plans. The second thing is I have a question, a favor, a request that I'd like to ask of you all, and that is to be very mindful about how you wear your mask. And specifically when you go to the dining rooms. The county mandate does require that you wear your mask unless actively eating or drinking. That does not mean when you sit down at the table you take your mask off and then you sit there for an hour at your meal and then you put it back on when you leave. You do need to keep your mask on when placing your order and waiting for your food. And then when you're done eating, while you're still conversing with your friends, put your mask back on. We've had some residents who have not been too happy when we've had to remind them of that being the mandate and have been a little grumpy with our staff. So please know those frontline associates are only doing what we're asking them to do, and the only reason we're asking them to do that is because we're trying to be compliant with that mandate. I know all of this has gotten beyond frustrating for all of us. It's a balancing act as we try to continue to maneuver through it, and we've made it this far. I'm confident we can make it through it together with all of us as part of the John Knox Village community. So with that, I'm going to turn it back over to Fran.
Thank you, Maria. Well, we will go on then with our committee reports, starting with Finance with Joe Chase.
CFO Kim Clockengay gave the financial presentation for July to the Finance Committee in the Missouri Room on August 25th, 2021. In July, there were 11 sales, which is on budget. On year-to-date basis, sales are 11 over budget. There were 12 move-ins in July, 1 over budget. Entrance fee proceeds are 67% of the annual goal, which is good. Occupancy is still difficult. Total occupancy in independent living decreased by 1 in July. Occupancy in the Village Care Center is 159.22 under budget and is still influenced by staffing issues. The VLA 400 assisted living is 21. The other assisted living units, including memory care, are 102 under budget by 14. Home health admissions increased in July, but are still under budget. Hospital census declined, but is still even with last year. During July, expenses exceeded revenue by $367,000. While revenue was up slightly over June, expenses increased by about $358,000, resulting in a reduction on operating contribution of $331,900,000. The increase in expenses were largely driven by increases in associate health benefits and utilities. Year-to-date operating contribution is negative, though is expected to improve as occupancy grows. Year-to-date investment activities is still strong, exceeding budget. The number of runs for EMS hit an all-time high, but revenue was below budget as we are still in the process of transition to third-party billing. We'll continue to watch closely. Days of cash on hand decreased 13 days in July, partly due to 3 payrolls during the month. Debt service coverage ratio is favorable to budget at 1.36. Net operating margin dropped to a minus 1.7%. Challenges, by far the biggest challenge is labor. Staffing continues to be the most significant obstacle as vacancies drive staffing agency expenses and census problems. The recent international nurses are currently in orientation and should be available soon. The largest agency usage is for certified nurse assistants. The end of summer means that high school and college students are leaving, particularly impacting the dining areas. Compensation adjustments have been made on 27 positions and impacted around 137 associates. The next meeting will be held in the Missouri Room on September 28th. Thank you.
Thank you. Health Services, Martha Wood.
The Health Services Committee met on August 11th in the Administrative Board Room. You may notice that that is more than a month ago, so there's a couple things that have changed a lot. Our speaker was Sarah Conniff, John Knox clinical dietitian who has been here 3 months. She has a bachelor's and master's degree. Following a supervised direct patient internship, Sarah worked 4 years at the University of Kansas Medical Center, focusing on nutrition for patients with neurological conditions, inpatient and rehab, as well as post-stroke nutrition counseling. She is also studying the needs of older adults with the goal of providing more natural foods for better digestion and more appealing presentations. At JKV, while spending most of her time at the Village Care Center, she has done some counseling of independent living residents, generally concerning sodium, sugar, and fiber intake. She is currently providing nutritional information to the independent living restaurants, including the addition of more nutrition-rich vegetables. At Fireside, she plans to include more soft, bite-sized food for those with swallowing problems. Sarah welcomes one-on-one nutritional counseling. There is no charge for this service, and a doctor's order is not required. Soon she hopes to offer group meetings and cooking classes. Anthony announced an Aging in Place fair for residents on October 15th in the pavilion. Village helpers, village home health, outpatient therapy, and fitness centers will each have a booth with information about all that they have available at John Knox Village. Village Assisted Living has a new administrator, Marie Winter Calvillo, who did start on September 7th. Promoted to Director of Nursing is Samantha Gladney. The 100 courtyard has been renovated. 2 associates tested positive for COVID-19, and there is increase on campus of both fully vaccinated and unvaccinated. Village Home Health has increased the number of new admissions. The new contract with United Healthcare allows for higher reimbursement per visit. The previous home health contracts, which are vital to Village Home Health, had not been updated since 2011, so we're overdue for an increase. Due to COVID, more acute patients are electing to skip rehab and go straight to home health. Village Hospice has a new social worker, Robin Layton, who has assumed the bereavement counselor position. And the seriously ill population program is back on the radar to start in January of 2022. The Village Care Center continues to be faced with staffing challenges and continued isolated COVID-19 cases. Every time there is a new case, the VCC must close for several days to conduct facility-wide testing. Outdoor visits are always allowed. A new and more efficient call system is in place on the rehab unit. And John Knox is looking at ways to attract and retain new CNAs, including increasing the minimum wage to $16 per hour. Maria Timberlake joined us to address resident questions concerning the current COVID picture at JKV. Village administration has discussed requiring all associates to be vaccinated, but is currently unwilling to do so for fear of losing critical workers while already short-staffed. Other local care facilities have not yet required vaccinations. At the care center, unvaccinated associates are tested twice a week. Also, restaurant hours may be changing, and they were. The 2 areas with the most personnel shortages are CNAs and dining services. Our next meeting will be, and was, September 8th in the administrative boardroom.
Thank you. Dick Erickson has a report from the nominating committee.
The Resident Council Nominating Committee met this month to consider action regarding the expiration next year of Jim Ham's first term on the John Knox Village Board of Directors. It was approved that his name will be forwarded to that board with the committee's endorsement for his second term. But according to the Resident Council guidelines, an announcement will be made for other residents to become board candidates. They must have resided in the village for 2 years. The nominating committee will be accepting nominations. Watch for the announcements in the Voice. Monthly committee meetings are scheduled for the remainder of the year.
Thank you. Resident Services Committee, Carol Jennings.
Resident Services Committee met on August 9th at 9:30 in the boardroom. The meeting was called to order. 15 members were present. Maria Timberlake, Dave Craver, and Eric Scott were also present. The minutes of the July meeting were approved. Guests Dave Craver, co-manager of grounds, and Eric Scott, director of operations, gave updates. The current landscaping projects were O'Brien parking lot, and that's coming along nicely if you notice that. Phase 7 villas, village assisted living courtyard, and a variety of others. Golf course holes 2, 3, and 4 have been renovated. A dingo, the new piece of equipment that has been acquired by the grounds people, has proven extremely helpful. It's an easily maneuvered machine that can typically carry and load dirt, dig trenches, dig post holes, and operate different attachments. 38 trees have been removed to prepare for Meadows 2, and 81 trees will be planted to replace them. Maria provided updates regarding gala ticket sales, a new lifestyles person at Meadows, and continuing challenges with positions in dining, which may require alternate restaurant hours. The handbook will be published again this year. With no further business, the meeting was adjourned. Our next meeting will be October 11 in the boardroom at 9:30.
Thank you. Anna Margaret McGuire has the report from Sales and Marketing.
Sales, Marketing, and Communications Committee met on August the 19th. 11 members of the committee were present. Mary Beth presented the monthly update, reporting that there had recently been 2 marketing events, one with a focus on the real estate market and a referral barbecue for prospective residents with approximately 120 in attendance. There have been 4 cancellations for Meadows 2 and are currently 23 deposits. There were also 3 leases converted to an entry fee. Plans for Phase 8 construction have begun with a variety of units to be announced later. In addition to a comment, there is an upgrade plan, in response to a comment, there is an upgrade plan in place for the Villager. At the end of July, there were 814 paying units campus-wide for independent living. Mary Beth led a discussion on various aspects of JKV communications and workloads with input from community members. The meeting was then concluded with a tour of the newly renovated guest rooms. The next meeting will be held on Thursday, September 16th in the Manhattan Room.
As you can tell, our committees have been working the whole time, and we're glad for that and glad to have all that information. Our program today is presented by Tiffany Speaks. She is the administrator of the Village Village Home Health and Village Helpers. Tiffany received her bachelor's degree from K-State and a Master of Science degree in Home Health Administration from Ohio State. She has been at John Knox about 9 years, and she's been involved in healthcare for more than 20 years. She and her husband have 2 small children, and we're glad she's here, and let's welcome Tiffany.
Well, hello everybody. Thank you so much for having me today. I'm so grateful to have the opportunity to come and talk to everybody about home health and village helpers. There's lots of great services that we have right on campus, and I am very excited to share a little bit more information about those. To start out, I know it's already been mentioned, but it was on my agenda to also mention the health fair that is happening in October. So Friday, October 15th, there will be more information coming, but please come by. I love being able to present, but I would look forward to seeing people and being able to answer questions. So there will be information about village helpers, village home health, the outpatient therapy services, the resident wellness clinic. So please come. Each table will have something fun that we're doing, and there'll be prizes. So be sure to put that on your agenda and visit with us that day. But For today, I wanted to just start out to say that we are here. Village Home Health is here on campus. We're here to serve you. And we not only serve campus, but we also serve 12 counties in and around the Kansas City metro area. That includes 7 counties in Missouri and 5 counties in Kansas. So on average, we see about 500 patients a month. We have a reach of around 500 each month out into the community. And that's quite a volatile number. I know that you guys hear in the financial reports how we're doing. It's typically around 200 new admissions each month to service, and then about 160 of those people discharge from service. And so, as you can tell, throughout the month, the numbers vary, but there are quite a few patients that we are servicing. You may be asking what all services is home health comprised of? So that's a great question. We have skilled nursing, physical therapy, occupational therapy, speech therapy, and medical social workers. And so what that means is that team of skilled professionals can come into your home to help you gain strength and independence, to help keep you safe and comfortable at home. So a lot of people will come to home health. Perhaps you have a scheduled surgery coming up and you'd like to do some conditioning before, some strengthening. You can do that. We see many more people on the backside of surgeries. You are welcome to sign up for those services as well. What you need for home health is you need a doctor's order. And it needs to be difficult for you to leave your home. So with that physician's order, we can come in and get started. If you have Medicare insurance, then home health services are free of charge to you, as long as we have all the qualifying criteria that we need. That's a wonderful benefit for all of those. And with other insurances, we do accept most insurance plans, and it is not hard to get started with home health services if you need it. We also have several specialized programs. So most recently, we launched a vestibular therapy program. We're very excited to have done that. We're one of the only home healths in the Kansas City metro area with this program. And what is vestibular therapy? Vestibular therapy can reduce the symptoms of vertigo, an imbalance, motion intolerance, all things that we could help with in your home. We also have an incontinence program. So if you're having difficulties with that, you can always give us a call to help sign up for that program as well. A cognition program. If you're finding perhaps it's difficult to retain information or you're getting a little bit more forgetful, we have a certified dementia specialist who can help with those. And so she performs what we call, it's an Allen Cognitive Assessment. It's a standardized assessment. But with that, she could walk through to help identify areas and ways in which we could help you improve upon some of those different things. If you are, like I had mentioned, if you're recovering from surgery, if there's anything going on that you feel like you could benefit a little bit more, if you can just give us a call and we can talk through all of that. So how would you get a hold of us? The best number to reach us is 816-524-1133. And we have a dedicated team of individuals that would help process through everything to make sure we got you in the right spot. So that's really what I had for you guys today. And I have a question. Yes, please. Okay, so to repeat, the question was, several years back, there was a presentation made to the Finance Committee. And at that time, it was shown and demonstrated that home health was continuing to lose money because they were just running into payers that were not paying. And the observation is that things have kind of turned around. And the question was, can I speak to why and what's going on with that? And I absolutely can. So you are right. With any service, we go out in good faith and we provide a service and we expect to be reimbursed for that service. Insurance companies, they have their own agenda sometimes, and fortunately or unfortunately, sometimes they do not choose to pay the bill. So what we've kind of done is, there's a lot of things that I've worked on, to be honest. First and foremost, the renegotiating the contracts. It's very important that not only do we have a contract that gives us enough money for us to be able to go out and provide that visit and still have a little bit of extra income. You know, we don't want to break even with each visit. We're in this business. We need to make it a business, right? Not for profit or not, it needs to be a business. And so we've renegotiated contracts to give us a little bit more cushion there. There is a payer that historically has been very difficult, and we have stopped seeing that payer. So we had one payer that had a very large outstanding bill. We will still service those patients on campus. So if you are a campus resident and you've got that insurance, we are going to see you. We are going to take care of you. But if you are out in the community, we're not. We're going to pass on that payer. And that's just because we know that that payer is very difficult to work with. So yeah, we've done a lot of little things like that to help turn it around. Also trying to track, you know, it's really important with all of our payers. Some of our, United Healthcare is a great example. We just renegotiated that contract, and certain plans under United Healthcare pay better than other plans. And so making sure that you're tracking those numbers and you're really paying attention to it, those are the things that have helped us correct that negative variance, if you will. Yeah. Yes. Yes, I can do that. So Village Helpers, the question was, can you expand on what Village Helpers does and what they do? So Village Helpers can do a whole array of services. They can really do anything from coming in to help you walk your dog, to provide light housekeeping, to remind you to take medication, to assist with bathing. Really, a Village Helper is there to do anything that you would like done in your home. They are non-skilled professionals. So it's not a nurse coming in. It is an individual who is there to assist you. You could kind of think of it as having, you know, a family member or a loved one that was coming in, but it is a paid assistant, if you will. The cost is dependent upon, well, for our village residents, you can book it by a half hour or an hour. And some of the contracts on campus, there's added benefits in there for discounted hours. So you could always just call to confirm how much that would cost for you. And I can give the number and all the information if you guys want to publish that out as well.
I have two questions.
Okay, go for it.
How does your unit fit into the organization?
Okay.
And what % of your work is outside the building?
Okay, so two great questions. The first one was, how do we fit into the organization with Village Home Health and Village Helpers? Okay, and then the second is, how much of our business is within campus and how much of it is outside of campus? So the first one, Village Home Health fits very nicely into the campus in several different ways. We have a very great relationship with the care center. So patients that go to the care center for rehab, about 1/3 of the patients that we receive on campus are coming from the care center. And so we transition those patients after they've been to the hospital for surgeries or for whatnot. They've gone to the care center for post-acute care, and they get to come home with us. And with us being the home health provider, then we have access into all of their records. And so it's not starting fresh with a brand new organization. It's someone who has communication with the people who have been treating you as well. We also see patients over in the assisted living. So if a patient in assisted living needed home health services, that would be our services. And we have that same software, same communication. You know, the way that I see home health fitting into the future with the village is even more important, because COVID's been a great example, but patients are choosing to skip other levels of care and go directly home, whether directly home is the safest place for them or not. We're seeing more and more acute patients at home. And so in the future, I think we'll continue to see that happen, and it's just that working relationship that we've got. You know, we also have cross-trained several of our therapy team members. So especially during COVID, if you were at the care center and then you transitioned home, you could have some of the same staff treating you again as well. And then the other question was, what percentage of our patients are on campus? A majority of our patients right now are off campus, but I am willing to tell you that I think there's a lot more opportunity on campus. I think that home health has a much bigger reach, and that's kind of one of the reasons I'm so excited to be here today, is I don't know that everybody understands that we're right here and all of the things that we can do to help. So the number is much smaller. We work in teams, and so we're assigned to different zip codes. The team on campus is, if you would most likely get the same nurse, the same physical therapist, the same occupational therapist each time. We of course have people take vacations and we provide coverage for one another, but that's kind of how it works. So we have one team that's covering campus, but we've got several teams all together. Yeah.
Home health people, you have to have a doctor's prescription.
In order, yep.
Everything with home health.
Yes.
And village helpers, you don't have to have any previous, you just call.
Correct.
Is that right?
That's correct. So I'm going to repeat that question for those of you at home. The question was, with home health, you have to have a doctor's order to get started, and that's absolutely correct. But the other piece of that question was, with village helpers, you do not, and that is also absolutely correct. So village helpers, because it's not a skilled service, you can call, and if we've got the availability, we'll get over to your house. Other things that I should have mentioned for village helpers with the holidays coming up, it's also, some people love to wrap presents and some people don't. And if you want help with things like that or decorating for the holidays, those are all things that village helpers can help with. But yes, no order necessary. Maria. We do. Maria just asked. We hand it out, I think last year during flu shot clinic actually, and we can hand out more. There's little wallet cards that we had purchased as John Knox Village that kind of have all the different services offered by John Knox Village. The idea and what Maria was asking is, don't we have that card that residents could have in their wallet? So if they went to a doctor's office or if they went somewhere and they recommended a service, you could pull that out and say, oh, we've got that on campus and here's the number for that. And we absolutely do. So if you're wanting one of those, maybe reach out to an area manager, reach out to myself, and we can make sure that you get one of those cards if you don't have one. Or come to the health fair on the 15th of October. Another plug. Yes. There is a fee for village helpers, yes. And what I had said is that it depends on the duration of time that you would like them to be there. And then also there's some contracted benefits for some built into some of the contracts. So if you call and you talk through what it is, it doesn't matter what we're there for. There's not a different fee for walking the dog versus wrapping a gift or doing laundry. The fee is for the time. So if you would call to walk through, we can get all of that straightened out for you.
Does village helpers go out into the community?
Okay, the question is, does village helpers go out into the community? And the short answer to that right now is no. For a while, we were out in the community, but with limited resources, we've really decided to focus all of our time and our energy on our campus patients. That's where the heart is, and that's what we want to choose to do. So at this point, we are not out in the community. The Lee Summit community, I should clarify, only on the campus. Okay. Guys, come to the health fair. I would love to answer more questions. That's the best part of the presentation, is the questions. So I appreciate your time today. Thank you very much.
Thank you. You did have a lot of helpful information, and I look forward to that health fair. Other announcements, I'm sure you have seen the flyer about getting your flu shot. There will be 2 clinics offered on campus. One of them will be Thursday, October 23rd, in Places Manhattan Room, and the second one will be Friday, September 24th, in this room, Courtyard Community Center. And it does remind you to please bring your insurance card when you come to that. And other announcements, our next meeting will be October 4th. And we will have Eric Scott, who is the Director of Operations and Development. He's going to give an update on some of the things going on campus. And as fast as things are moving, I'm sure it'll be a different talk than you've heard recently. He's also going to remind us about the recycling program and how we can help with that, and if there's some things we need to change. So we hope you'll tune in on October, or we will have the program on October 4th. We'll hope you'll tune in when it's shown. Thank you.